Survivors of COVID-19 might have developed dangerous after effects from the disease and not know it. This is what neurologist and interventional pain medicine Dr. Syed Moniz says. He's the medical director for Neurosciences Center in Imperial Valley.
After the COVID, we're still getting a lot of data in, and a lot of agencies are collecting this data, including CDC. And some of the most common things that are coming out after the COVID infection, neurological conditions such as dizziness, increase in headaches, severe vertigo, numbness, foot drop, hand drops, wrist drops, neuropathies, Guillain-Barré-like syndromes, which is a neuropathy, and also weakness in the arms and legs.
He says these conditions could lead to a stroke or worse.
Usually these symptoms, especially strokes, these are occurring at least 4 months or sometimes up to 6 months after the infection with COVID. So we're already seeing patients who have inflammation in the brain and the spine.
COVID seems to be causing serious neurological issues in some patients.
Just a few days ago, where patients developed more severe headaches, and patient has some neurological condition before. Then after we did an MRI, a repeat MRI, which showed significant amount of swelling in the brain, and which was the MRI was quite different than was the MRI done a few months ago prior to the COVID infection.
And some symptoms could mean you're in trouble.
Dizziness. So a lot of people think, oh, I'm dizzy. But if you have an increased dizziness since after COVID infection, that needs to be urgently be evaluated. Increase in headaches needs to be urgently evaluated. If you're having symptoms of numbness in your face, arm, leg, or if you're having mild weakness or having difficulty walking or have difficulty balancing, if you're having blurred vision.
Once you experience these symptoms, timing for treatment becomes critical.
Usually it would be you will see a primary care doctor, but in cases like this, we urge patients not to wait and directly contact us and call us so we can expedite the diagnosis as well as the treatment.
And waiting too long could lead to serious long-lasting damage to a person's health.
It may not be reversible. It may require long-term physical therapy. It may even not get better even after the therapy. So if we can catch it sooner and earlier, we can treat that.
For more information or for a consultation, please contact the Neurosciences Centers of Imperial Valley. It could save your life. Roy Durantes for RD Media Online.